Welcome. Welcome to everyone that is joining us today. This is BCHC Healthy Communities 2023 PlanH Grant Information Session. I am Connie Allsopp, PlanH Delivery Lead with the BC Healthy Community Society. My role is to provide supports, resources, and engagement opportunities for the PlanH communities. I'm also here with my colleague today, the Executive Director, Jodi Mucha, as she is stepping in for our Grants Coordinator, Stacey Chappell. This morning, we are pleased to share details of the grants with you and to do our best to answer all of your questions related to the 2023 application process for grants available for local and Indigenous governance. We are also hoping to get a sense of what communities are looking for, what we can do to support them, and who might be already applying this year. If you could pop in your names in the chat, and we look forward to hearing from you who's here today. I'll also do a land acknowledgement, and if you know the territories that you're on, if you could pop that in as well, that would be great. We'll look forward to hearing and seeing who's all here today. BC Healthy Communities offices are located on the surrounding traditional lands of the Secumseh, Esquimalt, and Lekwungen Songhees Nation, where we live, work, age, and learn. We anticipate that today's presentation will take about 30 minutes, which following we will invite you to pop in questions in the Q&A function and take about 15 to 20 minutes. So total might be 45 to 50 minutes. Just a quick reminder that today's session is being recorded, and it will be up on our session shortly after we finish, and then you can always come back and listen to the questions or watch the replay. We would also encourage you to post the questions specifically in the Q&A, but if there's comments going in the chat, we also have some team members, our colleagues behind the scene. We'd like to thank Pat and Monica and Gurmeet and Stephanie for helping us out with the chat and the Q&A and the technology behind the scenes. We are adding links and resources in the chat function so that you can actually click on them and go directly to the application, to the guide, and to the website so that you can easily find what we're talking about as we go through the slides. I'd like to just give you a little bit of the background of BC Healthy Communities and the PlanH grants. So you have a little context. BC Healthy Community Society started since 2005, and it's a province-wide not-for-profit that facilitates the ongoing development, healthy, thriving, resilient communities. We believe that it is possible and necessary to create communities where it's easy for citizens to be healthy and well. We operate at the intersection of planning and public health. Since 2012, PlanH has provided cash grants and in-kind supports to more than 250 communities across the province. The PlanH grants are for local and Indigenous governments. Specifically, they support local engagement and partnerships across sectors for creating healthier communities, provide learning opportunities, resources, and cutting-edge practices for collaborative local capacity building actions. And it recognizes that community policy, plans, and decisions affect everyone's health and well-being. And it partners with the Ministry of Health, specifically by supporting the province's health promotion strategy. And I must mention that there's additional funding that comes from Vancouver Coastal Health Authority for the healthy public policy in that region. Now, just a little bit about the Healthy Communities approach, and that's kind of what we're really talking about here today is in the grants, if you could really take a look at what it is that you're putting into the grant and come from a Healthy Communities perspective. At this point, the Healthy Communities lens, this approach recognizes the factors of social, economic, and environmental impact of our built environments, thus play a major role in determining health and well-being. Factors that focus on creating positive health outcomes in populations are called the social determinants of health. We also know it takes more than simply encouraging individuals to act and choose healthy behavior, but it takes a whole community to lead the way forward. More than just health care. Evidence shows that 60 to 75% of factors influencing our health lie outside the healthcare system. These factors are public transportation, affordable housing, available recreation opportunities, supportive social networks, local design, community design, and along the way, it makes it all easier for people to live healthy lives. It's also about removing barriers. PlanH supports projects that intentionally take an upstream approach. The approach that focuses on preventing poor health outcomes rather than responding to them after they emerge. It addresses the social and structural determinants of health. It takes place in our daily lives where we live, work, age, learn, play, with an overall goal of decreasing barriers and improving supports that allow all people to reach their full potential. There's an equity comes first as well. BCHC believes that at the heart of a healthy community approach is a commitment to equity, ensuring that systematic disadvantages and barriers don't get in the way of every community's aspirations. When we apply an equity lens, we want to know who will benefit from the policy, the program, and the service. We also want to know who might be excluded and why, whose voices are being heard, whose voices are not being heard nor considered in the decision. So for the application guide, each of these concepts, applying a social determinants of health, looking at an upstream intervention, and using an equity lens is critical. These are all highlighted within the application guide, along with some examples of local Indigenous governance have taken actions already in previous years by using these healthy communities approach and how to enhance health, community, and well-being in your local area. At this point, I think I'll hand it over to Jodi to talk a little bit more specifically about the grants and application process. Thanks, Jodi.
Thanks, Connie. I hope everyone is having a great morning. You've got a nice cup of coffee there ready to go through our application materials and receive all the information you need to apply for our PlanH grants. We're pleased to offer these again this year. So without further ado, I'm just going to mention that I'm standing in today for our grants and engagement coordinator, Stacey Chappell. And I'm going to go over all the administrative aspects of the PlanH grants, including the application process. And as you go through the application process, however, you're definitely encouraged to reach out to Stacey. You can call her or email her along the way with any questions that you have, and she's there at your service to help you with your putting together your concept and your application. And links to the grant website, they are being posted in the chat as we go, and you'll find them anytime on our website at planh.ca and our BC Healthy Communities website. So the PlanH Healthy Communities Fund, we loosely call it the PlanH grants. We offer funding that what that really is you receive cash plus facilitated customized supports from our BCHC staff based on whatever's going to make the difference for you and what you indicate in your application. And so we're offering 2 grant streams this year, and they focus on different aspects of healthy communities. One grant stream is community connectedness, and the other is healthy public policy. And I'm going to go through and review the eligibility criteria, which again is all in the application guide. I'll cover the application and the adjudication process, as well as more details about these 2 grant streams. And then I'm going to hand it back to Connie, and she'll talk to you more specifically about the community supports that we provide as part of the grants offering. So in terms of eligibility, of course, the first question for any grant writer is, are we eligible? And for the PlanH grant, it must be a local government that is the primary applicant. So this, when I say local government, this really includes municipal governments, Indigenous governments, and Métis communities. It also includes regional districts. So you can see the full eligibility list on the slide. along with some examples of who cannot be the primary applicant. If you are in an ineligible group who partners with the local government and the project meets the funding guidelines, the local government can apply on behalf of the partners involved in the project. So please note the local government or Indigenous government needs to be the active partner and the one who submits and is ultimately responsible for ensuring that the grant project work gets completed and all the funding is managed and funding reports are submitted as our requirements indicate. And as mentioned, our PlanH grant streams this year, there's two: community connectedness and healthy public policy. So first of all, the community connectedness grants, those are $5,000, and they're suitable for projects that really are about fostering community connectedness, community building, that rebuild connections as we emerge. Like, hard to believe it's been 3 years now, but emerged from COVID, but obviously we're all still dealing with a wide variety of ripple effects, and also that address the mental health impact of the pandemic and issues around social isolation, and really aim to build better, stronger connections and resilience in the community. Social connectedness, it's a vital aspect of healthy communities, and the community connectedness stream, it really does aim to reduce isolation and improve an overall sense of belonging in your community. So then next, the healthy public policy grants, those are up to $15,000 and include the in-kind customized supports from our BCHC team. Our team includes public health professionals, planners, community engagement specialists, and everyone comes equipped with a big toolbox of facilitator tools and planning processes so that they can support you with your work. Projects in the healthy public policy stream are meant to develop or amend policy that improves health and well-being of community members. So it's really, what's going to serve your community as a whole. And eligible projects, they may include things like policy analyst, policy analysis, public engagement in the policy process, research, implementation, or it may even be focused on evaluation. And again, as Connie mentioned, we really thank Vancouver Coastal Health for a partnership that we have with them. They provided additional funds so that we can fund more projects in the Vancouver Coastal Health region in particular. No separate application is required for that. We're just noting and acknowledging the partnership there. So thank you so much, Vancouver Coastal Health. And as mentioned earlier, each healthy public policy grant comes with, there's funding and there's support from our staff. There will be, and I think this link has already just been posted, a link that shows some examples of past projects that municipalities and local governments, Indigenous governments have embarked on in the past through our PlanH grants. So you can see those at the link that's been posted, and there's links in the application guide as well. All right, so now how to apply, the big question. So you can apply online through planh.ca, and the deadline is May 1st at 11:59 p.m. Pacific Standard Time. And the application is designed, it's set up in a survey software. So basically you log on, you can fill in all your information. Once you hit submit, we receive it. There is also a document on the website that gives you everything you need to know as you're preparing to submit your application. So there's I believe it's a PDF document that is the application form. So you'll have all the information you need there. So we recommend reviewing that application guide and those materials before you complete your application. And we've made the application quite simple, so it doesn't take a lot of time for you to fill out. Applications, they must include 3 key things: project overview, budget, and a brief work plan. So for the project overview, the web form includes questions about proposed activities, goals, and outcomes. And you'll be asked how the project will incorporate equity. I mean, obviously, equity is fundamental to all of our healthy communities work. It's at the core of all the work that we do at BCHC and fundamental to the PlanH grant streams as well. So you'll be asked how the project and the work that you're embarking on will incorporate equity, and what are your plans for evaluating success based on what you say success is for you in your community. So we posted the application questions on our website, and you can take a look at that link that will help you to prepare in advance. So then the second thing I mentioned, it's a high-level budget. So the budget should include the total project cost, not just the components funded by PlanH. So if you do have other revenue sources, then you need to include that, include any in-kind contributions, and note any other resources that you have to support the work that you're doing, so that we know to what degree PlanH is supporting something that might be a bigger endeavor. We allow you to use 40%, up to 40% of your PlanH funding for capital costs. So that would include equipment, furniture, building costs. You know, if you were building a community garden or doing some work on a cycling trail or something like that. And so an example would be if you took a community that was interested in the community connectedness stream, $2,000 of the $5,000 grant amount could be used towards your capital costs. And then thirdly, and last but not least, is your work plan. So like the budget, it should be high level and list the major project milestones, as well as who it is on your team that will be taking the lead for each of those different milestones. We provide templates. There's a budget and work plan template that are on our website, and so that you can look at those in preparation. And then when you fill them out, you'll upload those templates and send them in as part of the application process. It's optional, but encouraged to also include supporting documents that you may have. And this could include letters from partners, any reports that you have that speak to, you know, some other component of the work that you've done, or speaks to work that you've done and now you're applying for funds from us to piggyback on and advance that work. So reports, surveys, anything else that might help demonstrating the need for this project that you're applying for funding for. And we know that the internet, you know, even though this day and age and all the hybrid work, we still have some problems with the Wi-Fi and internet. So sometimes it's a barrier. And if for any reason you're using the web form and it's not working, you can contact Stacy, and you can email her at grants@planh.ca and make alternate arrangements to get your application to her. So we're trying to make this as accessible as possible and easy as possible for everyone as we go. And now for the application tips. So throughout the application guide, you will find there's tips. We're trying to make this as helpful as possible on how to strengthen your application. And these point to features the adjudication team will be considering as we select the projects. In our adjudication process, we are looking for a few specific things. So first of all, we're looking for projects that use an equity lens. And equity is most simply defined as leveling out access to opportunities, power, and resources. And is your project making a healthy community accessible to everyone, especially those who need it most? And is your project focused on a group that may be typically underrepresented, and or you know, they're not attending events, or they're not participating or showing up or having the ability to be involved in policy discussions. So we'd like to hear how you are incorporating equity into your plan. Next, we would like to know about partnerships. Multi-sectoral partnerships is one of the pillars of the Healthy Communities approach, and really indicates that for any Healthy Communities initiative to be successful, you do need a range of multi-sectoral partners. So that's what we're looking for, is your meaningful partnerships that you've already developed, or that you will be seeking to develop as part of your project. So we're looking for collaboration with your health authority, groups in your community across multiple sectors. And we found that in the past, these partnerships definitely help to make your projects more sustainable over time. The partnerships don't need to be set up at the time of applying, but definitely let us know who you see being part of the project team. Letters of support are not required, but if you have some, it's always helpful to include them. And I think this is a good time for me to also mention that that is actually one of the things that we provide as support, is that BC Healthy Communities has been around for a long time. We're very well connected, and we have that provincial vantage point. And so in many cases, what we can provide to you for your project work is helping to weave and connect and help to build some of those partnerships. And we can point you in the direction of other jurisdictions, other municipalities or Indigenous governments that may have worked on projects similar. So we're trying to help leverage resources and ideas, and can make introductions to help you with developing those partnerships to, obviously aim for sustainability of the work that you're doing. So partnerships are one way to make the project sustainable. And if you have other ideas about how the benefits of the projects will extend beyond the grant year, feel free to share those ideas. And then next, evaluation. If you have a plan to evaluate your project, definitely let us know. We'd like to know, are you going to be collecting data, like handing out surveys? How are you going to record this kind of information and document it? And what kind of monitoring plan do you have? We'd like to hear what's going well so far and what might be some of the potential barriers for your community. And the reason we're asking about evaluation is because it helps to make your project stronger. We're not so much asking for us in terms of your local community project, but it definitely helps equip you with data and information that makes your projects stronger. But then it also equips you for down the road. If you're applying for other funding, you now have data to point to and evidence to point to when you're making funding proposals and requests for, continuing the ripple effect of your work. And we recognize that another bonus of evaluation is that it provides materials to be included in your final report that you do submit to us. And I will speak to that in a few minutes. Again, if you have questions along the way, feel free to reach out to Stacy. She can answer questions along the way. She can help you with ideas that you have to frame them up to ensure that they meet our criteria. And all of those kinds of questions are also indicated in our application guide and the FAQ section on the PlanH website, which I believe Stephanie will post in the chat right now. Thanks, Stephanie. So yeah, we love hearing about your project ideas. So definitely call Stacy. She's a fantastic resource for you and ready to work with you on your ideas. And all right, so the next slide here, key dates. So this is a reminder of the application date and other key dates to keep in mind. So the deadline to submit your application, May 1st. We will notify applicants of the result in June. And then for the selected projects, the funded activities can start at the beginning of September and must be completed 1 year later. So by the end of September 2024. So you will have up to 12 months for your project work. Obviously, if it doesn't take that long, that's totally fine. You can submit your final report earlier than that. So there is a requirement to submit a final report and a budget by the deadline, which would be October 1st, 2024. And the way that we award the funds is upfront when you are notified that you're successful and you fill out your letter of agreement. We will provide you with 80% of the grant funds, and then 20% of the award is held back, and we will provide it to you once you submit the final report, whenever that is, a year later, or if you do it earlier, we will provide you with the funding at that time too. So the report, it's very similar to the application form, and we will ask for key points on your local capacity building that took place during the duration of your project, what's changed because of the project, and we like to know what What did you learn? What capacities were built? And we will share a link to a previous year's final report, so you have an idea, and if you wish to look through that, you'll have a sense of what we would be asking for. It foreshadows the information that we would be collecting. So there'll be no surprises. It's very similar to what we're asking in the application form, and then you self-report at the end. This completes my overview of the grants, the nuts and bolts, and I'm now going to pass it back to Connie, and she's going to speak a bit more about these customized supports that we love providing to you in your communities. And she'll speak to that. She's our delivery lead, so she knows all things capacity support. So without further ado, back to you, Connie.
Thanks so much, Jodi. I appreciate you going through and stepping in and filling in for Stacy. She'll be certainly watching maybe today, so we thank her for all the work that she does to help everyone with the grants. Someone has asked for her phone number, and I will provide that as we go through today. Just to recap, the Healthy Communities Fund, the PlanH grants, include the two parts, the cash and the in-kind supports, and resources, provincial engagement opportunities, where we're connecting projects that are similar across the province and community convening calls, supports that are also requested by consultation, sometimes by email. Sometimes we do a face-to-face on Zoom to understand, called an onboarding call. Alternatively, we've also gone out to communities and done workshops in collaboration with the team at the local level. So there's a variety of supports that we can do. It depends on what your community needs for the building capacity, and supporting strategies for planning, monitoring, or evaluating. We've helped communities to design their surveys, supporting resources from the BCHC. We have in multiple sources of action guides and other links that we provide to webinars, etc. We're also hosting the community convening calls and researching various topics. We did one on stigma this year, and developing strategies for in-person and online engagements. We've also done one webinar on Zoom with an owl that was scoping the room and having chats with people at the local level to make it more engaging. Maybe check out the engagement guide and see for details of the in-kind supports for the PlanH communities. If the type of support, however, is not listed, please do reach out. You can contact Connie at BCHC, BC Healthy Communities, or Stacy, our grants coordinator. We certainly look forward to hearing from you what needs you think you might need, as well as what unique supports that you might specifically want designed for your community. So we can't certainly get there and do the project, but we can certainly collaborate with you to make things happen at the local level. And we certainly understand that if you need additional supports beyond what we have listed, please add those in your application. I wanted to thank everyone for signing in today. And before we go, I just remind you that May 1st is the deadline to get this in. Stacy is available at grants@planh.ca, and her phone number 778-404-0510. I'll repeat that phone number, 778-404-0510. And I know that there have been questions that have come in, so I'm going to put Jodi on the hot seat to help me out here and answer a few questions. Delighted to have you, Jodi, as the executive director, with the history that you have with the organization since the beginning of the organization, 17 years. I'm delighted to be asking questions for you so that you have some really great ones. Binda asked, can a corporation apply for the fund if having a partnership with a local government?
Yeah, so the focus of these grants are for local governments and Indigenous governments. So you would need to reach out to your local government, and I mean, ultimately these grants are for local and Indigenous governments so that they're developing policy change in their community. And there's that whole of community approach. So you want that level of decision making and the buy-in involved. So I would approach your local municipality and talk to them about the project idea. And obviously it needs to align with their vision and they endorse it. And then they would need to be the ones that are responsible, ultimately responsible and submitting the application. So, yeah.
Thanks, Jodi. Here's one that says, what are some examples of customized supports? I really only have the last year, so I don't know, Jodi, if you want to add some that I haven't added from previous years.
Sure. Yeah. So what we do is once you are notified that you're the successful grantee, then we will set up a call with you, especially if you've applied for the Healthy Public Policy stream, because that one's more substantial. And there's a question and some tick boxes in the application saying, you know, what kind of supports do you think you need? And we've done our best to provide a bit of a trigger list, but there's also a bit of an element of, you know, you don't know what you don't know. So you just kind of think, well, I think I might need some support for evaluation. And then we'll get on that call with you and we'll just ask you in your own words, tell us more about your project, like embellish a bit on what you put in your application. And then we're really listening for what's going to make the difference. And in some cases you may say something and then we'll think, oh, you know, it might be helpful for us to help you develop some partnerships with these folks. So it's really going to be a bit of an organic process. We're going to be listening for, you know, what might be some challenge areas for you. We'll hear a little bit more about your vision, some of the things you may have been struggling with, and then together we can identify what that might look like. So some examples of that could be, well, we've helped some groups with their evaluation to ensure that the evaluation plan that they developed, we call it equitable evaluation, so that you're really thinking about the full degree of involvement in your project and how to evaluate those different, potentially marginalized groups or whatnot to ensure that the project work is meaningful to everyone. We've had a municipality ask us to deliver an equity 101 1-hour kind of a training in the form of a webinar for their planning staff, so that their planning staff now were more equipped with how to apply an equity lens to the project work that they're doing through PlanH, but also beyond, obviously. What else have we done? We have worked on, one of the municipalities is working with the Indigenous community that's neighboring to develop an elders engagement framework. And so they vetted ideas by us. In some cases, we participate as part of a member of a planning committee, or support the project work in terms of framing up ideas to then take to the council for further discussion. So yeah, a wide range of things. And again, it's really going to be determined in collaboration with you based on your needs.
Thanks, Jodi. I appreciate that. We also have one. What about a city applying on behalf of a not-for-profit organization?
Interesting question. Again, these grants are for local governments and Indigenous governments. So I think that
maybe the collaboration.
Yeah, it needs to be a partnership. Like ultimately, you can't just be the local government just submits the papers and has nothing to do with it, and then the local organization does all the work, but local government's not involved. They need to be involved, because obviously we want this to be something that is led by, driven by, there's involvement by the municipality, so that there's more of a foundation of leadership and thinking about this initiative to make the difference for the broader community, if that makes sense.
And I guess more people involved at different levels and different organizations helps it become sustainable. And that's one of the things that we're looking for. So another question there, fabulous questions rolling in here, Jodi. So you're really going to be on the hot seat for a bit here. So thanks for helping us. Can it be for multiple projects under one not-for-profit organization being applied for on behalf of a city or government? So multiple projects.
Multiple applications?
No, it's multiple projects. I think if there's an umbrella idea or concept where you have multiple actions coming from that, possibly. So if it's an umbrella concept that you're trying to go for a larger goal of equity within the community, and you're taking several different steps to make that happen, or a strategic plan that has community connectedness, perhaps, and then that involves 3 smaller sessions for connectedness, that might work. I hope I'm getting the sense of your question there, but it's multiple projects under one application. I'm thinking what we're trying to answer there.
Yeah, I mean, ultimately, you just need to make the links so that we see that you see the links. So it might be that we're developing some community wellness guidelines.
Yeah.
And to do that, we are going to do, we're going to host some engagement sessions. We are going to have an event, and we're going to do, we're going to conduct some research and do another thing. Like, these are the 3 things that we are going to do to fulfill on this. We're asking you for this funding, and we're going to do these 3 distinct things to get there. So yeah, that makes sense.
Do you require a council resolution in support of the application for PlanH?
Gosh, I think we just, yes, I'm pretty sure.
I'm thinking that you need letters of support, but it's not the same as the age-friendly communities.
Yeah.
Where we don't need specific, but
I
guess.
Yeah, here we go. Oh, okay, I'm correct. I'm correcting myself. This is on the website. We changed this recently. So do you require a resolution from city council or chief and council in order to apply? No, we do not require a resolution from city council or chief and council to apply, although indications that there is council buy-in definitely strengthens your application.
Yeah, so it just is the sustainability that it lasts longer.
Yeah.
Is there a threshold for projects that will be funded for a community connected grant? For example, an existing city program receives 100,000. Can they still apply for 5,000 grant to supplement the programming?
Oh, yeah. I mean, if you're leveraging funding from some other sources and you're applying to us for some aspect of you have a broader vision and you've got resources from this and a grant from that, no, that doesn't impact our adjudication. We're really just looking at you're making a proposal and a request for the funding that we offer for this certain component. So you would want to be really clear that the funding that we're asking for from PlanH as part of this broader thing is for this, so that at the end we know this is what our money helped you to do. And that also then helps us to go back to our funder, who is the Ministry of Health, in terms of our accountability, to say the money you provided us that we gave to communities, this is what it was used for, and this is the outcome or the impact that it had as part of this broader thing. So again, that's the kind of thing that you can call Stacy and talk through with her, and she can give you some pointers on thinking about how to frame that in your application. But yeah, there is no threshold.
This is a follow-up part to a question, Jodi. It's PlanH will not pay us directly as a not-for-profit, but it's something that if we're contracted by the local government, they receive the funds and then they transfer them to us as the not-for-profit. How does that work?
Yep. Again, so the grants are for local governments and Indigenous governments. And so we would release, because they ultimately are the ones that are responsible at the end of the day. So we will develop the MOU with the municipality, the local government, the Indigenous community, and we will release the funding to them. And then now if they're working with you as a contractor, they will then have their own agreement with you, and they will pay you as they've agreed with you. And you have your own agreement, but our agreement is with the local government and the Indigenous government, and how they do the work and how they partner, that's up to them, but they're ultimately responsible back to us.
So they provide the memorandum of understanding so that it's signed by a local or Indigenous government for us to process the funds. Thank you. I guess if we were looking at what if the project does not yet have a start nor a completion date identified? Should we defer grant application until we have definite dates, or can we estimate our dates in our plan and our work plan?
Yeah, you can definitely estimate. I mean, obviously it needs to be completed within the year, which would be starting September 2023 through to the end of September 2024. You could just loosely put a date like, we expect to begin in September, or, engagement activities will start in October. Part of the supports are us reaching out to you and checking in. And so obviously it's about communication. As soon as you have the plans in place, you have more sense, you can just let us know. And we do expect that the project work is done, within that year window, but you can let us know for sure.
October 1st, 2024 is when we're looking for the evaluation. Although we have had communities, I don't know if this is public knowledge, but we have extensions sometimes where understanding what's going on in a local community, we do take consideration for case by case example and look at an extension based on what's needed. So hopefully you can get started during that time and then wrap it up by October 1st, 2024. And if you need a little of an extension, we can also have that discussion, community by community discussion.
Yeah, and obviously we're trying to work with you as best as we can to support your, local context, anything that you may be dealing with. We receive money from the funder, so we have, we're in a little bit of a box, if you will. We're responsible, but we do everything that we can to be flexible with you, to work with you. And we know things change. I mean, especially coming out of COVID, and we know everybody's down in capacity and all of that. So we are trying to be as flexible as we possibly can.
Another question here. I run a free program aimed at reducing domestic violence in Prince George. We have been asked by Fort St. James and Yukon communities to bring our program to them. Since we are a not-for-profit society, they would have to apply to the grant, but we could be partnered. Yes, absolutely. And we'd love to support the partnerships. And we also can help you partner with, if you call Stacy or give us a call at BCHC, we can also help find people in your region that Jodi has her connections with multiple people across the province to help you find health authorities or other local government connections that might be suitable for you to partner with. Can we apply for both grant streams?
You can, but I'll be honest, it's highly unlikely you'll get both. We apply an equity lens when we're doing the adjudication, and we like to have as much spread across the province as possible. And then we're also looking at a nice distribution of, this number of food related projects, this number of housing projects, this number of, diversity, equity, inclusion project. So we try to have a spread. I think there's been a couple of times where we've applied, we've had a successful municipality that's applied for both streams, but I mean, we don't have a high number of grants to give out. So I don't know, if I were you, I'd apply for the higher one, the healthy public policy one with your idea versus the community connectedness, if you're thinking from that regard.
Well, and on the side note, I've also been encouraging ones that have applied for the community connectedness that if something from a policy perspective arose from that conversation, then they apply the next year. So the first year is the 5,000. And then the next year they look at policy that came out of that first community connectedness and apply for the 15,000. The other is that little commercial break here that I'll toss in here is that BCHC also has age-friendly community grants opening soon for 15,000 and 25,000. You can apply for both if your project is two distinct components. Age-friendly communities are intergenerational. So if you're looking at improving the community in a way that helps all citizens, older adults, and really become healthier in your community. So just stay tuned for those coming on our website as well. The other offerings, so there's 3 here commercial breaks. We have an equity curriculum invitations for PlanH communities that are the CAOs and the mayors that will be coming soon to just as an equity 101 curriculum to help just a greater understanding province-wide of what that looks like. And the third offering is that March 30th. So next week, mark your calendars on Thursday that we have a webinar coming on climate change and well-being, building resiliency through social connectedness with Dr. Kifferkard and 2 speakers from our local 2021 PlanH communities. So if you want to get an idea of what's already happened in a community related to this topic is the village of Daggeen Geets, Hideaway, Jay Myers, and Caroline Beaumont. So we're really excited to be sharing some success stories with you, as well as some content about climate change and well-being. So stay tuned for those 3 upcoming commercials. And thanks, Jodi.
Yeah, Connie, that just makes me think that I'll add something else about one of the other supports that we provided is obviously we can help you with bragging rights for the great work that you're doing. We love to share your stories as you're going through your process. We're happy to work with you to develop articles. We are always reaching out as we're delivering these healthy public policy webinars. We're always looking for our grant communities as examples to come on and speak to how they're influencing policy change in their communities, how they're developing partnerships, how they're collaborating, what they're learning. So we always love to have the opportunity to work with you, share your story. And also, again, we're at that vantage point where we've worked with hundreds and hundreds of municipalities and Indigenous governments over the years. So you might be working on something that we can say, oh, you know what? They did something similar in this municipality a couple of years ago. We can make the connection and you can learn from them, or we may have some frameworks or some plans that they've developed that we can work with you to help scale those out and expand so that you're not reinventing the wheel. So again, we're at that vantage point where we can do that weaving, connecting, and sharing resources and helping to learn across the different communities in BC.
Mm-hmm. Thank you, Jodi. And yes, we are recording this, so we will be posting shortly on our YouTube channel and our PlanH.ca for the replay. One more question came in. Is the Equity 101 tailored for mayors and councils? Yes.
Oh, what a perfect question. Did somebody seed that question? Yes, it is.
Yeah, that is exactly our audience, and we're hoping to support all of our PlanH communities with helping all levels of government understand what that is. So specifically mayors, councils, and CAOs.
Yeah, and I'll just throw in a little plug for that as well. I mean, really right now, what we're trying to do, my vision is that we have something like a Healthy Communities Academy, and that we're able to offer a wide range of courses and information, online learning that's, the fundamentals of healthy communities. And we're starting with this, and it really is Equity 101, but it's for that level of leadership so that it makes it easy for those who are in a decision-making position. It's definitely different than those that are out there on the front lines doing the work. And so the more we can equip those who are the visionaries and the decision makers with that kind of broad context, then it's definitely easier to incorporate that equity lens into programming, planning processes, the development of partnerships, you know, at the staff and even the elected levels. So it's starting off with fundamentals. We will pilot it this year. And then based on that, our vision is that we'll develop a whole range of other healthy communities courses on there and offer those to beyond just, you know, CAOs and elected. So stay tuned.
Yay. And thanks so much, Jodi, for being here today. And thank you everyone for joining us. I believe we had over 50 people online, so very delighted to be sharing. The replay will be up shortly. So we have some more questions. Jodi, will there be an invitation link to the Equity 101 webinar, or where do we find it? It'll be a personal invitation that we'll send out to people. But again, if you have questions, reach out to us and we can follow through with you one-to-one on that.
And actually, I'll just a bit of clarification. So we're piloting it. We developed it and beta tested it last year. And so this year we're piloting it with a set number of CAOs and like those in the decision making. So we will go out, we'll pilot it, we'll incorporate the feedback, and then we'll look at going out more broad. So, you know, there'll be some information out there as we go, but yeah, we are testing it. This is our first time to test it live with people. So,
and so there's another question here, Jodi. In a large urban municipality, who within the hierarchy qualifies as an eligible applicant? A supervisory staff member, a department manager? Can you give us an example?
It doesn't matter. I mean, whoever within the department has the is granted the opportunity to take the lead to apply for a project. I mean, I'm assuming you'd need some type of approvals. Whoever has the idea would potentially need some type of approval. You deal with that and submit us your application. It just needs to come through from the municipality.
And also the work can be done by consultants. If that's where you're allocating the money, you can allocate a portion of it to hire someone to, if you don't have capacity at your local level. So you apply and then you have other people helping you collaborate to launch the project. Another one here, does the Vancouver Park Board Community Engagement Coordinator qualify to submit an application on behalf of a community center or a specific community center recreation supervisor hired by a municipality? The Vancouver Parks Board Community Engagement Coordinator.
So the Parks Board is not, is it connected to the municipality?
The question came in that, or a specific community center recreation supervisor hired by the municipality. So I would think yes. If they're hired by the municipality, I would say yes.
Yeah, in that case, yeah. If it's kind of part of that organizational structure, if you will, then yes, because again, the application needs to come in by the municipality. So let's just say it's the City of Vancouver. City of Vancouver would submit the application, and it would be that, you know, that department or the Parks Board.
Yeah,
it's developed it.
Yeah. So your local administrators won't be able to attend the Equity 101, only those in the pilot group? This is going back to the equity curriculum.
Yeah,
local administrators.
Yeah, possibly. We're just working that out right now. I think we wanted to let you know about this equity curriculum, but we also don't want to say like, guess what? And then, oh, no, you can't. But yeah, possibly.
Yeah.
There's excitement about it though. It's good to hear.
Yeah, there's excitement, and we're hoping that we have lots of uptake so that we can really launch it. There's another question here. We have an EDI unit already working with TransLink on our EDI and GBA research. We believe that they have great potential to help our local governments with social capacity building, can we apply on their behalf after having that partnership set up?
Again, talk to your municipality, and then you would work with them to put the application together, and then the municipality would submit it. And it may be you doing the work, but again, it's a municipality that put in the application, and then the project would be listed as, again, using City of Vancouver loosely as the example, the City of Vancouver is working on da-da-da project. And you may be the ones that are actually doing the work on the ground.
And sometimes this year we've had at the onboarding call, we've had chief financial officer attend just at the beginning to sign off with the memorandum of understanding. And then they're nowhere in the whole project or call after that. So until the end, and then we submit. So there is a portion of the grant that is held back for the evaluation to be sent in, or for contact conversation, oral presentation of what your findings were for capacity building. And then that's where that person would come back on board. So certainly you can go ahead and fill out all the application and then have them come on board for the final signing and the sign off and that kind of part of the collaboration with you. So you're mainly doing the work, and they're partnering with you by helping support you with the financial end of it. So I don't know, we don't have any more questions coming in. Any last word, Jodi, around as we wrap up? We have 4 minutes before the top of the hour.
Well, again, there's lots of examples in the materials that we've developed and on the website that will give you a sense of the kind of projects through community connectedness and healthy public policy that we've funded in the past. So we'll give you a bit of an idea. Obviously, again, if you're brainstorming ideas, or you're wondering if your project would be eligible, you can reach out to Stacy and she'll provide you with some insight and some guidance on that. I think that we've done a pretty thorough job over the years of compiling the kinds of questions that we've received, so that the materials on the website are, I think, pretty thorough and clear. And I mean, obviously that's our aim, is to make it more and more clear each year as we go. But yeah, just pick up the phone, and good old fashioned phone call. And Stacy likes talking on the phone, which is great. It gives more of that personal touch. So yeah, just give her a call, send us an email, and we're here to help you. We want you to succeed. We want to fund great projects across the province, and obviously we want to brag about those great projects too. So whatever we can do to support you, we're here to support you in that.
So with your reports, we love to see any kind of videos or photos or anything live that's happening. And an example of one of the supports is this March 30th HPP webinar on climate change and well-being. Several of our communities this year are working on health and well-being. So building resiliency through social connectedness was one of the ones that came up as a topic. And so that's one of the supports that we're doing for all communities. So hopefully you'll reach out to us if you have any questions or requests for supports, and we look forward to hearing your grant application. So just a reminder that May 1st is the deadline, and we thank you again for being here with us today at BCHC as we share about our PlanH grants.
Yeah, and I'd just like to say again, thank you everyone for your vision and your passion. I know it's been definitely a tough few years. It's hard to believe there were 3 years, COVID 3 years now, but now everybody's dealing with lack of capacity. And I'm still so amazed and inspired by the incredible work that's continued to go on across the province. And so kudos to all of you. And hopefully the supports that we provide and the bit of cash that we can offer through the PlanH grants helps you with our work. And our BCHC staff team is really here to support you and help with some of that capacity that you may not have in your local community to pull these projects off. So thank you for your partnership to build healthier communities across the province. And I think that's it for us today. So thanks, everyone.